Well, the New Zealand oxygen study was undertaken to work out whether oxygen is helpful or harmful in patients who are having a heart attack. So it's been widely used for many years, but we don't know the answer for sure to that simple question. The study design was a design of real-world use. So what we did was we used two oxygen protocols, a liberal protocol where oxygen was given routinely for patients who had ischemic chest pain, and a conservative protocol where it was only given if the oxygen level fell below saturation fell below 90%. And those two protocols were used as part of usual care. The study was done in New Zealand, which is a small country, a bit under 5 million people, and the study was done in the whole country. And we randomised the use of these protocols into usual care in the 4 regions of New Zealand which reflect where people are cared for when they have a heart attack. And so the ambulances, the emergency departments, the cardiology units and the catheter labs, they all use the same protocol at the same time. And the protocols were used for about a year each region, both protocols. And then we were able to link the information to the national registry to find out what happened to people and who died. Well, what we found was that the mortality was almost exactly the same for people who were managed under the high oxygen protocol as the low oxygen protocol. It was about 3.1% at 30 days. And pretty well exactly the same. So that implies that overall, at least, there was no clear benefit or harm for patients by giving oxygen to people with suspected heart attacks or heart attacks. Well, the other large study of oxygen is the Swedish detox AMI study, and that was done in a slightly different way. They actually randomised patients individually and gave them high flow oxygen or not. And they found the same thing, that there was no clear difference between the two oxygen protocols. So there were differences in how the study was done. They had a smaller sample size, we had a much bigger one. But overall, the main result was the same. Well, overall, we found no clear benefit or harm from the oxygen. One thing that we did find, though, was that there did seem to be a possible benefit when the oxygen saturation fell below the normal range. So when the saturation was less than 95%, the mortality was much higher, 4 to 5 times higher. And it's possible that those patients had a benefit from the high oxygen to return the oxygen to the normal level. But we couldn't, our study wasn't big enough to confirm that for sure. So there's a bit of uncertainty there.